Realizing the impact that emergency events can have on our community, we have developed contingency plans to address weather, chemical exposures and spills, as well as a wide array of other events and scenarios that we routinely practice our response to.
As the emergency manager for Delaware County, I oversee the fire, emergency medical services, and 911 program. We also oversee the emergency management program to make sure that our residents are kept safe. It's important to remember if you have a chemical spill at your home or place of business that you monitor and turn off the heating and ventilation system. This system could transport the noxious fumes throughout the building and affect people that aren't directly involved in the incident. If you should have one of these incidents at your facility or your house, you should immediately exit the building. Once you exit the building, you should phone 911.
During a patient influx into a hospital, the emergency department will sustain the major impact. We are at the front line of meeting patient needs when they are at their most vulnerable. If you have been exposed to an unknown or hazardous material, call 911 and let the trained responders come and help you. This will give the hospital advance notice to properly prepare for your arrival and to set up a decontamination area if it is warranted. By doing this, you will help us to stay healthy and be able to continue to help you and others.
You need to follow this lady right here.
Come right on through, step right into that lady in that tent right there. Keep right on going.
Delaware County Emergency Medical Services works hand in hand with O'Connor Hospital to ensure that you will receive the care that you need when you need it most. Our EMS personnel have the knowledge and training needed to provide the best care possible in emergency situations.
When a state of emergency is called in Delaware County, it's very important that you stay home. We have trained responders, both fire and emergency medical services, that can come out to your house and help you and transport you to the hospital at a time of need.
If you have an appointment during a state of emergency and roads are closed, please stay home. We will reschedule your appointment as soon as possible. It is not worth your safety or the safety of others to travel when the roads are unsafe. It is vitally important to create an emergency preparedness kit for your home and car that will keep you ready in the event of a disaster. If you have a baby in the house, do not forget baby formula, non-refrigerated milk, diapers, bottles, clothing, and remember to have a first aid kit for everyone in your house. Along with your first aid kit, have a fire extinguisher and a variety of flashlights. You will need food and water, and don't forget your pet. Replace your batteries and perishable items every 6 months. Keep a list of emergency phone numbers, vital health and household records, including Social Security cards, insurance policies, wills, passports, birth certificates, photos of your house and property in good condition. Cash and traveler's checks are also other important items to consider to keep in your emergency preparedness kit. Let's not forget a list of any medications you might be on. Remember to at least try to keep a 30-day supply of your medication on hand at all times.
To keep you up to date in an emergency, it's important for you to follow the emergency as it progresses. To do this, you should monitor the website, www.co.delaware.ny.us, the local radio stations, television stations, and you should sign up for New York Alert.